Hey gang, Scott with the Scott Gartner Group, and we have a great one for you today. Many of you probably seen our video with Health Solutions, Brian Thompson. He introduced us to MVP Medical Care. This is gonna blow you away. This is the new cutting edge medicine. We think this is gonna change lives. Come on in. Hey, Dr.
Hey.
Jen.
How are you? So
I'm
wonderful
good.
to see you.
Thank you. Isn't this like Johnny Carson or something? Ed McMahon. Come on in, Ed. But hey, thanks for having us today.
Absolutely.
Really, the reason we're here is that what I do is integrative and functional medicine. What that means is they aren't just there. Well, I shouldn't put it in my words, but how would you define it?
We're here to resolve disease from the underlying cause. And the definition that I use of functional medicine is getting to the root cause of disease by using the research that's done in the lab that usually takes 20 years to get into medicine once the pharmaceutical company has developed a drug for it. Not because it's great information, but because there's a drug for it now. So we use that information right from the lab to say, okay, how do we get the body working better so that you don't need medicine? You get better from the inside out. So everything I do from MERT to taking care of somebody is based on, okay, what's not working properly, what can we make work properly, and how do we get the brain working better?
I just heard a great analogy. I want to throw it at you, see if it feels good. That a normal medicine is kind of like your trouble light comes on your car, and the solution is to cover it over so you can't see it anymore and say that's fixed. Meaning, you're covering over with medications and stuff that would address the symptoms, but not the reason the light came on.
Correct.
Is that pretty?
And the classic example of that in migraine headaches is Botox injections. Like how there's so many patients out there who have daily migraines or chronic migraines that get Botox injections. Well, that's a neurotoxin that's injected into the base of your skull, so it gets into your brain and into your tissue. It kills brain cells, and you have to get it every 3 months.
Wow.
Because as soon as the Botox wears off, it comes right back again. Underlying cause of disease? Not at all. You're covering up symptoms, and you're getting worse in the meantime.
That is awesome. So, okay, so we're going to do a series on these because this is really I love this kind of stuff, and I hope you guys too. But to me, this is where medicine needs to go, and I hope that it does.
I've sworn for 10 years now, since I learned functional medicine, this is what we all need to be doing. And I think COVID has brought that out a little bit more so because there's so many people that distrust medicine now because of everything that happened with COVID. There's a lot more people paying a lot more attention to how they're feeling and what we can do to get people better.
This again, probably off topic, but what I can hear in your speaking, I'm not knocking doctors. I think I've got a really good one. But really, really, I think his job is to get me out of the way so he can get to the next person, because there's a lot of people who are having pain. And what I hear from you is, I'm trying to solve a problem. And maybe that's kind of your deal.
It is.
Yeah, you like solving problems.
I like solving the problems. The harder they are, the more complex they are, the better I like it.
That's a goosebump.
Dig down and figure out all the little pieces that are fitting it together. That's why I never liked regular medicine, because it's cookbook. If you have this, you have 3 choices. If you have that, you have 3 choices. Well, if I got a problem now, what's the whole paradigm? And adrenal function, your kidney, liver function, detox system, food that you're putting in, like where's the problem?
So really, this is a gift to you, isn't it? This is like doing...
Absolutely. This
must feel like you found your calling.
I absolutely did. From the very first course in functional medicine, I was like, oh my God, this is it. And that's how I got myself better. Because I got into functional medicine because I ended up in 6 years of daily migraines. And I was at every doctor you could see, neurologists, 5 different neurologists, psychiatrists, because of course it was all in my head.
Right.
That's what I got told over and over. Well, you're just stressed, you're a doctor. I'm like, well, if it's just stress because I'm a doctor, then every other doctor out there would be just as sick as I am. And trust me, they're not. And so after 4.5 years of being put on 5 different meds, seeing all these neurologists, nobody could get me better. I ended up at Mayo Clinic at the head of neurology, and he's like, well, I can offer you Botox, hence my Botox comment. And I'm like,
Seriously?
Botox, that's the best you can do. What else do you have? He's like, nothing. There's nothing more we can do. Just go home and take disability.
And Mayo is known for problem solving, right?
There was no problem solving. Correct. There was no problem. But this was my medicine. This was what I'd spent 20 years trying to get to be a doctor and 10 years practicing as a physician. And then they said, forget it, we have nothing more for you. I was like, that's not okay. I'm a doctor enough to realize this is medical and that there's other answers here that you're not looking into. And that's how I got into functional medicine. So I live this. I breathe it. It's keeping me alive. It got me where I am today. Otherwise, I'd be divorced and homeless and on disability somewhere. I mean, literally, it would be that bad. Because I almost committed suicide several times in the midst of those 6 years.
Oh, I'm sorry. I can imagine. That must
was horrible.
be brutal.
It was horrible. Living in hell for 6 years.
So, yeah, what did you wind up?
Well, those daily migraines, talking about migraines, that ended up being chronic mold issues, chronic Lyme disease, and adrenal failure. The headache were actually adrenal failure from chronic mold and chronic Lyme.
Okay, that's pretty random and obscure. How on earth did you find that?
I got better with functional medicine and with frequency-specific microcurrent, which is an energy healing treatment. I found out 4 years later, after I already had kids, as I was working with a patient, she came in and said, I got mold toxicity. I'm like, no, you don't. That doesn't really exist. And she's like, no, this is my story.
That's not a thing.
Right. And then she said, no, this is my story. And I said, oh my God. Like, yeah, you do really have that. I was like, you're going to make me learn about all this, aren't you? And she's like, dang straight I am, because I need some help. And so I started learning about it. And I was like, oh my God, that's my whole practice. That's like 3/4 of my practice has all of these issues. And then I was like, oh my God, that's me. And I can tell you where everything happened along the line. Now that I look back, I'm like, oh yeah, that's me. I'm all of this.
Wow.
So it's thank God for all my patients. They teach me so many times more than I could ever figure out on my own.
I believe it.
They force me to get into things that I might otherwise neglect. But all of what they do helps me help everyone else.
That's awesome. Well, look, you don't even have to, all this other stuff, all the terminology. You get a sense of Dr. Jen. She wants to make a difference in your health. Honestly, don't take my word for it. Come meet her. You'll know. It's immediate. So thank you very much. We're going to do more of these if it's all right with you.
Love to.
Just to talk about some of the other things that you do.
Yeah, my passions.
Yeah. Thank you very much for having us.
Absolutely. Thank you.
Wow, that was a lot, but I hope at least out of that you got a sense of Dr. Jen and MVP Medical. This place is a huge resource for anybody that doesn't feel well, particularly if you've got something nobody else seems to figure out. But this is really going to be the first in a series. We'll be back talking to Dr. Jen about some other things they do. But really, I think this is a great resource for you guys. It's just south of Pinnacle Peak. We'll put a map in the video so you guys can find it. Come on out and see these guys. Meet Dr. Jen. Thanks for listening.